Hi, Mr. Petiti. My name is Maddie. I'm going to be the nurse practitioner who's caring for you today. How are you doing?
Great.
Awesome. So today you're here for an exam of your head, ears, eyes, nose, throat, and also your respiratory system and your heart. Does that sound okay?
Mm-hmm.
Okay. I'm going to begin my exam now, if that's okay with you.
Mm-hmm.
Okay. So I am visually inspecting the patient. Do you mind just looking straight forward for me?
Mm-hmm.
Thank you. I'm just looking for symmetry, any obvious scars, anything like that. Everything looks good.
Good.
Great. And then I'm going to go right into my ear exam. So his ears from the side look fine. They look nice and symmetrical from the front as well. I don't see any swelling. And I'm just going to look in your ears with this scope. So as I'm looking inside of his ear canal, I'm pulling up and back to straighten out his ear canal. And I'm visualizing the tympanic membrane. It is pearly gray. It has a cone of light that is about 7 o'clock. And I don't see any drainage, any erythema. I don't see any edema. And as I'm taking the scope out, I am continuing to visualize the inner ear canal as well. And then move over to the other side. And I'm just using light pressure on his ear as I'm pulling it back. And the other side looks the same. The tympanic membrane is pearly gray. It has a cone of light at about 5 o'clock on the right side. I'm going to move on to your hearing test now, okay?
Mm-hmm.
So I'm just going to make this vibrate, and I'm going to put it on the top of your head. When I'm doing that, would you mind just paying attention to see if it's even, the hearing is even in both ears, and just let me know when you can't hear it anymore, okay?
Mm-hmm.
Do you mind taking your head off for me?
Mm-hmm.
Thank you.
Mm-hmm.
You hear that?
Mm-hmm.
Was it even in both ears?
Mm-hmm.
Okay, great. So we'll do the Renee test now. So I'm going to make this vibrate again. I'm going to place it on your mastoid process, and then I'm going to move it away. And as I'm moving it away, tell me if it's louder when it's on your bone or if it's in the air. It should be louder in the air. Just placing it on the mastoid process. Can you hear that?
Mm-hmm.
Can you hear that?
Mm-hmm.
Which one was louder?
First one. The air.
And then again, mastoid process. Moving it about 2 centimeters away. How about that one?
Same.
Okay, great. Glad to hear that. And then
Cool.
the last test that we move on to is the whisper test. So I'm going to whisper some words, and I just want you to repeat them back to me.
1, 2, 3.
Good. Okay, so you could hear my whisper test too.
I sure
So everything is normal with your hearing test there, which is great. We'll move on to your eyes now, okay? So can you look just straight towards me?
Mm-hmm.
His eyes look even. I don't see any obvious swelling. His sclera is white. There's no tearing or crusting or anything like that. I'm just going to touch your face, okay? I'm going to pull your eyelids down. Just look straight towards me. And then can you look to the left and to the right? And then up. Okay, great. I'm just going to look at your upper lids too. Sorry, sir. I didn't see any swelling, redness, drainage, any crusting. I apologize if that made your eyes dry.
It's okay.
And then will you just follow my finger with just your eyes, okay?
Mm-hmm.
So I'm just testing the extraocular movements of his eye. And as I'm doing this, I'm just looking for smooth movements. Do you have any blurry vision or double vision? No? Okay, great. That looked good too. I'm just going to take a peek at your pupils. So I do have to shine a little bit of a bright light into your eye, okay?
Mm-hmm.
So just look straight towards me. I'm going to help you keep your eyelid open. Sorry, just look straight towards me. And as I'm doing this, I'm looking for his pupillary response.
Jeez.
His pupillary response is good. His pupils were about a +3, I would say. And they were equal, round, reactive to light, and they are accommodating, okay?
Mm-hmm.
Both pupils were reacting at the same time, and they were the same size the whole time. I'm going to just check your eyes a little bit more here. So just look at my finger, and I'm going to bring it closer to your face.
Cross it.
Good. Yeah, I know, I'm sorry. His pupils constricted as my finger got closer, so that was good too. I'm just gonna check your lymph nodes and things now. I'll do a little bit of palpation of your head and your neck, okay?
Mm-hmm.
Would you mind removing your hat again for me? Thank you. So as I'm palpating his head and around his neck, I'm checking for a couple things all at once. I'm checking for any edema, any tenderness. Does any of that hurt as I'm pressing?
No.
No? Okay. I'm checking for any other abnormalities, scars, lesions, bumps, and then I'm gonna check for his lymph nodes at the same time here. And I'm just palpating the suboccipital lymph nodes back here, and then moving on to the posterior or auricular lymph nodes, the preauricular lymph nodes here, and then down to the submandibular lymph nodes, the submental lymph nodes, and the cervical lymph nodes here. And I'm not feeling any masses. I'm not feeling
That's
any
good.
palpable lymph nodes, which is good. Any palpable lymph nodes would be an abnormal finding. I'm going to palpate your clavicle lymph nodes here. Do you mind kind of like arching forward for me? Yeah, like that, so I can kind of get in there. Does any of this hurt or is this tender at all?
No.
Okay. And then here are the okay, everything felt good with that. I didn't feel anything abnormal. Next we'll move on to your mouth. So again, I'm just doing like a visual inspection first. His lips are symmetrical. Would you mind opening your mouth for me wide? And then show me your teeth. Good. And all of his contractions are symmetrical. As I'm doing this, I'm also evaluating his dentition. He looks like he's got great teeth. He takes very good care of his teeth. So I'm going to get my tongue blade out. And I'm going to ask you to just stick out your tongue. All the way out. And then can you lift it up for me? Okay, great. I'm just looking at the orifices of his salivary glands under his tongue. Can you keep doing that, please? Thank you.
I have that.
And then move your tongue side to side. Good. And if this was a real tongue blade, I'd be putting it in his mouth. I'd be moving his buccal mucosa aside to kind of take a peek at that, making sure it's pink, it's moist, there's no lesions, no sores. I'm looking at his dentition in his mouth, and then I'm going to try to visualize your oral pharynx back here and your tonsils, okay? So just keep your tongue behind your teeth there, and I would be depressing his tongue with the tongue blade, and I would be visualizing all that. I would see that he has no drainage in the back of his throat. There's no cobbling. It looks just like a normal pink, moist. If he had tonsils still, they would not be swollen, but this patient actually had his tonsils removed, so they are absent. And everything looks good with that. Okay. I'm just going to take a peek at your nose now, too. Have you been having any nasal drainage or any issues like that? Great, glad to hear it. His nose looks nice and symmetrical from the front. From the sides, it looks good. He has a very nice nose. And then do you mind just tipping your head back for me? So I can visualize his nasal septum and his nasal canals. And again, I would be using a scope with the proper thingy on it. And I'm just gonna touch your nose, okay? And I would pull it back kind of, and I'd insert the scope away from the septum to visualize the middle and superior turbinates on both sides. Great. I don't see any obstruction. I don't see any purulent drainage, any excessive drainage. I don't see any lesions. Everything looked good in there. No erythema, no edema. And then as I have my scope out, I would be changing the thing, and I'm going to take a peek into his eyeballs now, okay? So I'm going to be using a scope to like shine a bright light into your eyes, okay? I'm going to be looking just at the back of your eyeball, just to make sure everything looks okay in there. So as I'm doing this, I'm using my right hand with my right eye to look into his right eye. And because he's a little, you sit up just a little straighter for me. That's probably a good height to kind of come in. So I'd come in with the light, I visualize the red reflex, and just keep looking straight towards me, okay? And I'd come in, and now I'm visualizing the back of the eye, and I can see the orbital disc and the orbital cup, and I'm visualizing the arteries. I don't see anything abnormal. And then I can kind of move, keep just looking straight towards me, and look at the macula as well, which I do last because it's very bright for the patient. Was that okay? Are you ready for the next eye? Sorry if that was bright.
That was only one eye?
Yeah, sorry. As I move to his other eye, I use my left hand with my left eye to look into his left eye. So I'm going to do the same thing. And I see the red reflex. He's looking straight towards me, and I move in. Sorry, Cleo. I move in, and now I'm visualizing the back of the eyeball with the orbital disc and arteries, and I can visualize the orbital cup, which is a little bit of a brighter spot. And I'm moving all around to take a look at everything in his eyeball. And then I can move to kind of visualize the macula as well. Which
How's
is
my
very
macula
bright.
look?
It looks good. It's a little bit of a darker spot in there, which is good. It's how it should be.
Oh.
But I'm sorry if that was bright. Thank you for letting me do that. Okay, turn this off. Now I'm going to palpate your neck and your trachea, okay? So, again, just visualizing his trachea is midline. I don't see any shift. It's looking good there. I'm going to touch your neck a little bit, okay? Good, I'm glad. And I'm just going to feel your thyroid cartilage, which is your Adam's apple. It feels normal. I don't feel any swelling. Can you swallow for me? Great. I'm going to palpate some of your salivary glands, your parotid glands up here. Okay? And then your temporal arteries. I'm feeling for any masses. The temporal artery, I'm feeling has just a nice light pulsation. I'm just move behind you, okay? And I'm just palpating under his chin here for additional salivary glands and masses. Which I don't feel any masses or anything, okay? Great. I'm gonna have you open your jaw while my fingers are on your, yep, right there, good. And close. Did that hurt? Do you have any pain, any clicking? I don't feel any clicking or anything in his TMJ here. And he's not endorsing any pain, which is great.
0 pain.
Love it. So I'm just going to move on to listening to your heart and your lungs now, okay? Excuse me. So yeah, thank you. I'm just going to ask you to take a couple deep breaths in and out. Good. Good. And then again. I'm listening for any adventitious breath sounds. And in the posterior, I'm listening at 10 different points. And I am moving my stethoscope and listening to each spot on each side in the same, to kind of correlate. Great. I didn't hear any crackles, any rhonchi, any rails, anything like that, so your lungs sound great, which is good. And then I'm also going to do a couple other things with you for that too. I'm just going to percuss your chest a little bit. So, yeah, thank you. And I'm doing it in the same spots that I was listening to. And I'm just listening for the tympani of his chest. And I'm noting if there's any dullness anywhere, which I do not hear. And then I'm going to ask you to do a couple other things. We're going to do something called a whisper test, okay? So I'm going to have you whisper the word 99 while I'm listening in your chest, okay?
Mm-hmm.
So go ahead. Just whisper 99. And again. Great. While he's doing that, what I am looking for is I'm listening for, I know she's being loud. I'm listening for his whisper to be getting like less loud as I'm moving away from his larynx. If it was to be the same volume that I'm hearing as I'm moving away, that would be an abnormal finding, but I did not find that at all for you. And then just one more like vocal test that we're going to do is I'm just going to have you go ee. It's okay, whatever. I'm just going to have you go ee, and I'm going to be listening throughout your chest, okay? So go ahead. Can you keep it the same tone the whole time?
Try to.
No, you're doing okay. Thank you.
E.
High pitched, please. Like E. Thank you.
Oh, E. I'm sorry.
Sorry. You can take a breath if you need it.
Thanks. E. E.
The same tone. Please,
It's
the whole time.
hard. E. E.
Great. Thank you.
You're welcome.
I know that's annoying. I'm sorry. What I'm listening for with that is if that E ever turns into like an A kind of sound, that would be an abnormal finding. But it was a good old E the whole way through, so everything sounds good with that.
Roughy.
Yeah, I'm sorry. And I'm just going to listen to your heart now, okay? So as I'm listening to his heart, I'm going to listen at the aortic, the pulmonic. You sit up a little straighter for me. Herb's point. Tricuspid. And mitral. Great. I'm listening for S1, S2, which are there. I don't hear any additional heart sounds. There's no murmurs, no friction rub. Everything sounds good there. I'm also doing a visual inspection. I don't see any signs that he's got any heart disease. There's no clubbing of his fingers. He doesn't have any cyanosis. His capillary refill is good, less than 3 seconds on both sides. I'm just gonna feel your radial pulses, okay? I'm palpating his radial pulses bilaterally at the same time. I don't feel any thrill. And I'm just going to palpate your carotid pulse. That's good, no thrill. It's not bounding, it just feels like a normal pulse. Do you have any wounds on your feet or any ulcers anywhere?
Nope.
Any numbness or tingling?
Nope.
Okay. At this point, I am going to ask if you wouldn't mind laying down for me. I have a pillow here for you you can have. Sir?
You want to put my head this way?
Sure, yeah.
Uh-huh.
Oh my god. Please tell me that I was recording that. Okay, good.
Yeah.
Okay. I'm going to listen to your lung sounds again while you're laying down, okay?
Mm-hmm.
Or your heart sounds, excuse me. So again, I'm listening. Aorta. Pulmonic. Herbs point. Tricuspid. And the mitral. Great. And as I am doing this is kind of a good time to feel the PMI, which I can actually feel with him in this position. If I couldn't feel it with him in this position, I'd ask him to lay a little bit more laterally left, and that could help with that. I'm also going to be looking at your JVP, okay? So this is something, I'll use this as a straight edge. This would be in centimeters normally, but I only have an inches ruler. So I'm just going to ask you to turn your head a little bit to your left and just try to relax your neck down. If you need to scooch down a little bit more so that your head is on the pillow. And then just turn your head a little to the left, please. So I'm visualizing his jugular vein here, his internal jugular vein. And I'm looking for the pulsation. And I can see it there. And then I'm now going to find his sternal notch, which is about right there. Taking the ruler, and I'm taking a straight edge across where that pulsation is at the top. And I'm looking at how many centimeters that is above his sternum there. And it's about 3 centimeters above, which is a normal finding. And then you can add 5 centimeters to account for where his aorta actually is, in there below the sternum. So it'd be about 8 centimeters, which is a normal finding. I think 6 to 8 is usually a normal finding to estimate his jugular vein pressure. I'm going to palpate your aorta now in your abdomen a little bit, so I'm going to be touching there. I'm just feeling for his abdominal aorta. Which is good. I can feel it pulsating just slightly, but it's not bounding, which is great. It's a normal finding.
Find something on there.
I'm just going to listen to your carotid artery too, okay? And I'm using the bell of the, thank you sir, of the stethoscope here. I don't hear any bruit or anything like that. Great.
Really?
I'm gonna take a peek at your feet now, okay? So is it okay if I remove your socks?
Mm-hmm.
Okay. So as I'm looking at his feet, I'm just gonna palpate his dorsalis pedis pulses, and his posterior tibial pulses as well. Just relax your feet for me, okay? Good, just like that. And they are about +2. I don't feel any thrill. His posterior tibial pulses are palpable, no thrill. They're about a +1. They're a little harder to feel, which is normal. I'm going to be, you could just relax your legs down for me, sir. I'm going to be feeling your femoral pulses, so they are right here, okay?
Mm-hmm.
So is it okay if I palpate your pulses right now?
Jeez.
I'm sorry. I would normally maybe ask them to remove their pants so I can do this a little bit easier, but we're not going to do that today. Those feel great too. They're about +2.
Yeah.
No thrill, and then his popliteal pulses as well behind his knees. I am palpating. And they're about a +2, no throw. I don't see any wounds on his feet. His feet are warm. His capillary refill is less than 3 seconds. Do you have any numbness or tingling in your feet, sir?
Nope. I can put my socks back on.
Sure.
Nurse, thank you.
You're welcome. So that concludes our physical exam for today. Did you have any questions?
No.
Okay. Well, thank you very much.
Thank you, nurse.